So what happens in your first prostate checkup if you're having prostate problems? I'll be covering exactly what to expect from that first appointment, why it's so important, and near the end, I'll explain how, as a doctor, I try and rule out prostate cancer. If you're new here, my name is Khalid. I'm a family doctor from London. Let's dive straight in. So the main question would be, why go and see a doctor if you're having waterwork problems? So the simple answer is symptoms of age-related prostate enlargement, aka BPH, and prostate cancer can overlap massively. It's a complete minefield. You won't really be able to know one from the other. While BPH is not life-threatening, won't put your health at risk, prostate cancer, if missed, can put your life at risk. And this is why we as doctors have some tests that help us distinguish between the two. So a quick caveat before I jump in, this is a structure that I use for my appointments while I run my clinics, and while the doctors that you see may do the same test, they may do it in a slightly different order. It's just down to preference. So the very first thing we do is to basically have a chat about your symptoms. We as doctors are trained initially as you walk in and sit down to ask open-ended questions. So you may hear something like, how can I help you? Or what brings you here today? And the answer that always makes me chuckle is the bus. But jokes aside, open-ended questions allow people to express all of their symptoms without the restrictions that you would have if I just ask you, tell me about your prostate. And this allows me to build a far better picture of what's going on. My aim in this history-taking part is I'm trying to be a detective. I'm trying to rule out other conditions that can give you similar waterwork issues or problems. So a urine infection can give you an increased frequency, going to the toilet more often, can give you urgency, needing to run off quickly, can give you hesitancy, not having a proper good kind of go at your urination. And it may also give you some other symptoms that you may not get with prostate problems. So it may give you a temperature, it may give you some lower abdominal pains. Likewise, I'm also trying to rule out other conditions. Diabetes, for example, people who have diabetes or don't know they have diabetes may have an increased urinary frequency. They may be more thirsty or they have weight loss. And the other one is kidney stones. So people who have kidney stones may get an increased frequency, going to the toilet more often. They may get some dull aches in their sides. Now, once we've had that chat, I would go on to do an examination. And this is the part that maybe puts off a lot of men from actually going to see their doctor. And to be fair, in that first appointment, I tell my patient, I say, would you like me to examine your prostate? So classically, what everybody knows about a prostate examination is the doctor puts a gloved finger into your bottom to check your prostate. But that, again, can be daunting if you've never met the doctor, don't know who they are, random person, probably not the kind of thing you're just going to jump into. So what I do is the very first appointment, I take the history, organize some blood tests, and then get them to come back, and we can then do the examination of the prostate in that second appointment. That also allows the patient to have like an expectation of what's going to happen next. So they've kind of mentally prepared themselves for the next appointment. Also, some studies show that doing a prostate examination just before you're doing a blood test for the prostate may sometimes artificially raise the prostate blood test, although it may be very, very marginal. This is why I sometimes do the blood test first, get them to come back and do it in the second appointment. So if the person doesn't want to have that prostate check done then and there that day, they'll come back for another day. What I always do is I always do a urine check. So the urine check is for microscopic levels of blood, proteins where things are leaking, and also signs of urine infection. So if you're ever going for a prostate, your first appointment for prostate, always take a sample of your urine, because we as doctors really appreciate that because it saves time for us. We can do it there and then in the clinic. And the next step would be to do some blood tests, and the panel of bloods I normally check for are PSA, kidneys, liver, diabetes check, cholesterol check, and also a full blood count. Now, normally men that come in when they're worried about their prostate, they've probably not had any blood tests for years, so I take this as a good opportunity to do some of those general men's health type blood checks. Obviously, if they've had these blood tests like a month, 2 months ago, probably PSAs are the only really important blood test I would be doing. Now remember, if you've got a PSA blood test booked in, there are some really important things you need to make sure you don't do beforehand. The very first one is ejaculating in the past 48 hours. Second one is a vigorous exercise 48 hours before. Third one is if you have a urine infection. And the last one is if you've had a biopsy of your prostate in the 6 weeks prior to this blood test. All of these things can make your PSA higher than it would be. And now circling back to the evidence for does a digital rectal examination, a doctor putting a finger up your bottom, increase your PSA. To be fair, the evidence for it is really 50-50. Some studies show there may be a slight marginal increase. Other studies have shown that it's probably not super significant. So if a patient is ready and prepared to have that examination in the first appointment, then I would do it. But if not, and they opt to do it in the second appointment, again, that's perfectly sensible to do. Now, what happens during a digital rectal examination? So normally what we would do is ask you to make your way across to the examination couch. That's a flat couch that you'll be lying down on. Normally the patient lies down on their left-hand side. They would lower their trousers and underwear, and they would also bend their knees up towards their chest, so they're in a prone, almost like a fetal position. That allows the examination to be less painful for the patient. The doctor would then put on some gloves and apply some jelly onto their index finger before inserting their finger into your bottom, with permission, of course. And the aim here is to feel the surface of the prostate. Is it smooth? Is it symmetrical? Do you notice any craggy, lumpy kind of areas? It would be more worrying if it felt, very uneven and very, very enlarged. And sometimes we can pick up if it's just normal enlargement as well. Now, in your second appointment, you'd be coming in for the results of your blood test. We talked about a blood test called PSA. The important thing to say is it's not always very, very precise for prostate cancer, meaning that if it's raised, it does not mean you have prostate cancer. It absolutely means we need to get things investigated, but sometimes it turns out that people don't have prostate cancer, but they can have a raised PSA. So usually what we would do is that if your PSA blood test is raised beyond the age threshold that you were in the UK, we would refer you within 2 weeks to a urologist. That's a specialist in the hospital. And they would think about doing something like an MRI scan of your prostate. And sometimes they would also do things like a biopsy, which is to go in and take a small piece or chunk of the prostate and look at the cells under a microscope, see if those cells look cancerous. And also, like on the flip side, if you have a normal PSA, it doesn't mean you don't have prostate cancer, which is why we tend to do the digital rectal examination so that we have those two pieces of information together. We think combined, it gives us slightly more confidence, whereas just one of those on its own, whether it's the PSA or the examination, probably doesn't give us as much confidence. So we've talked about what to expect in your first doctor's appointment, but if you're wondering what kind of prostate symptoms need a doctor's review and the worrying symptoms to look for in prostate cancer, then click on this video because we go into deeper detail on that. I'll see you on there.